Welcome, everyone, to the Transformation Nurse Academy podcast. This is our weekly episode, Talk with Kevin, where we cover topics for all nursing fields with extra emphasis on emergency and critical nursing. Get ready for candid discussions that explore the vast landscape of nursing and beyond.
Welcome you bitches to the Transformation Nurse Academy podcast. My name is Kevin, and I know I've been around a while, but I've had a lot of shit to do. And I love you, but you know, family comes first. I've had a 10-year-old turn 11, and then I had my 18-year-old graduate from high school. And my son is supposed to be fucking taking his driver's test for the third time today. He can't pass that motherfucker, but maybe today he will. All right, you guys, I hope that you stay safe this summer. It's getting fucking hot. It's raining. Shit, Texas had snow or sleet or something like a week ago and shit. And here in California where we live, it's 110 fucking degrees already. And it's only June, so I don't know what's going on. Maybe they're trying to burn us up and shit. All right, so today, this comes from Oregon. I saw this on TikTok from APR and Beauty. Federal regulators put Oregon State Hospital on notice after patient death. Well, this has been going on for quite a while. This is nothing new, but it always fascinates me. How the hell do we let patients die in the hospital? And who's to blame for it? And who's going to get thrown underneath the bus? So this story comes out of Oregon State. Oregon State Hospital is in immediate jeopardy of losing its eligibility for Medicare and Medicaid funding in the wake of a patient's death. So if you don't know what immediate jeopardy is, an immediate jeopardy is a term used in healthcare, particularly in the context of regulatory compliance, such as Medicare, Medicaid, and Medicaid services. In the United States, it refers to the situation where an entity's noncompliance with one or more of the terms of conditions is likely to cause serious injury, harm, impairment, or death to a patient receiving care in that facility. So we've experienced this many times. I've been in this field for 30 years, and immediate jeopardy is nothing new, but most people aren't aware of it. But immediate jeopardy means that your facility could be shut down right now because you guys are fucking shit up. So failure to do so can result in severe penalties, including loss of accreditation or termination of Medicare and Medicaid funding, meaning we ain't going to pay you bitches. And if they're not going to pay the hospital's not going to pay you. We could talk about immediate jeopardy. So definition again, starting by, we're going to talk about immediate jeopardy, talking about in the context of healthcare regulation. It emphasizes the significance of a situation that a healthcare provider fails to comply with certain standards that poses immediate threat to one's health and safety. So in this case, in a state hospital, staff at Oregon State Hospital failed to make hourly checks of a patient who died of a suspected fentanyl overdose in May, public records and hospital staff said. So this is one thing I talk about in my classes that I teach all the time. I ask nurses, particularly on med-surg and tele, and I'm not picking on them, but it's the easiest to see because most of the time, like in the ED, we're always checking on the patients. Well, not always, but most of the time. So when you're on the med-surg tele floor or any floor, especially here in California, how often do you do hourly roundings? Like, do you go every hour? I mean, I know that's an oxymoron. I'm asking you, how often do you do hourly roundings, which means they should be fucking hourly. But a lot of people tell me that their charge nurses and managers say, don't wake up the patients because patients complain that they have to be woken up. Well, first of all, you're in the fucking hospital and everybody's going to wake your ass up to see if we can fucking do your vital signs, if we draw labs, your medications. It depends on where you're working. However, this is the problem I have. If you read your fucking hospital's policy, almost every one of them here in California says you have to perform hourly roundings. So for the rest of you out there are other 49 states, do you have policies that specifically state when and how you should wake your patients up or observe them? You know, what is the wording of your policy? Most people don't even know they have a policy because they don't read that fucking shit. So on May 24th, this is this year of 2024, on May 24th, the patient was last observed alive 4.5 hours before staff found the person unresponsive. So what the fuck was people doing for 4.5 hours? Nobody watched this son of a bitch? Like, I don't get that shit. I know it's a psychiatric hospital, but shit, people are people. And if you're going to be a nurse, you got to take care of everybody. All right. It says on May 24, the patient was last observed alive 4.5 hours before staff found the person in their room unresponsive, federal regulators said in a Thursday notice to the Oregon State Hospital. The state-run secure psychiatric hospital in Salem. As a result, the Federal Centers of Medicare and Medicaid Services, or Medicaid Services, put the Salem Hospital in immediate jeopardy status, which means it could lose its certification and eligibility for federal funding if it doesn't make swift changes to fix the problem. This happens a lot in the EDs. We had to make swift changes where I work, and I'm sure several hospitals did because, psych patients, when they have issues, they're going to try to attempt to commit suicide, and if you're not watching, and if you don't look at the room and think about things that they could choke themselves on, stab themselves on, or stab you, bad shit can happen. So you got to think about that. So staff who conducted continuous rounds during that night shift failed to determine whether or not the patient was alive. Well, then how could it be continuous rounds if you don't know if the patient is alive or not? So the death was at least the hospital's second fatality since April. So in a month and a half, they killed more than one person. So it says I can't fucking talk today, bitch. I'm so dry. I got fucking drunk and shit yesterday. I was celebrating my daughter's birthday. Sorry. All right, let's start this shit again. The death was at least the hospital's second fatality since April that federal officials have connected to inadequate medical attention for patients, public records show. Each time the hospital has faced the threat of losing its federal... Each time? Does that mean they've lost it more than once? What the fuck? Each time the hospital has faced the threat of losing its federal certification, which also demonstrates whether it's capable of meeting essential standards of the hospital. So I'd like to know, I know it's a psych facility, but how many nurses work that truly have psych training, like psych training? So in the latest instance, federal officials determined the hospital failed to ensure the patient's safety based upon a review of security video footage. So you bitches, your own fucking video and shit. Like, you don't think nobody's going to see that you ain't doing your job? I don't understand that one. Most hospitals have videos now, so you know that you're on tape. Anyway, the video footage, which showed staff didn't determine whether each patient was alive and breathing, the notice says. So that means they probably drugged them up and let them sleep? I don't know. I don't know what that means. The document doesn't disclose the cause of the patient's death, but Oregon State Police and hospital staff have told the Capitol Chronicle the patient died of a suspected fentanyl overdose. So was the fentanyl given by the patient himself, herself? Was it given by the staff? How did it get into the facility? Those are questions I'd be asking. The state police agency is investigating the death, which is a standard procedure for all unattended deaths at the state hospital. After the death, the hospital suspended all outside in-person visits with patients, citing an unspecified incident with contraband that a visitor brought into a patient. So if it's a state hospital, do they not screen people? I mean, I don't know. I don't know how that works. So if you're working in a hospital that's a psych facility, let us know. Anyway, the hospital sent an email on May 29th to remind staff to check patients on their rounds. Really, an email. Y'all bitches can't get out of your hospital offices, you administrators and fucking charge nurses and managers. You're too fucking fat and lazy. You can't get out and go talk to your people. Like, don't they deserve to see your face? An email. An email was sent to remind their staff to check on the patients and do hourly roundings. But a video review afterwards, 2 nights afterwards, minimal to no change. Duh. Look, I'm going to send an email, bitches. Y'all better follow what I say. Nobody's going to pay attention to your dumb emails. The time and proximity of staff looking through windows of closed patient rooms in darkened rooms were not sufficient to assess whether patients are alive. Oh, I get this all the time from my nurses in the hospital. Oh, I peeked through the door and I saw them breathing. Have you ever heard of the term apneic gasping or agonal gasping? You can still breathe and you hear... It sounds like snoring and shit, but it's actually the patient dead. So go physically check on your fucking patients. You are going to be held responsible if you don't. That's the problem. So the time and proximity of staff looking through the windows of a closed patient doors in a darkened room was not sufficient to assess whether patients were alive or not. The report also said in one instance, a patient entered and stayed in a room with 2 other patients of the opposite gender without detection. So they going in there having either a booty call or maybe they're raping somebody else. Like, what the fuck, dudes? The hospital cares for more than 600 patients at one time. So that means there are probably over populated and understaffed, and people are just tired and don't give a shit no more. I don't know that to be true, it's just my opinion, but I can foresee that. So the hospital cares for more than 600 patients at one time, the mostly suspects who need treatment to face charges. Oh, shit. So that means it's a terrible place. In response to the report, the state hospital is directing staff to make regular, thorough checks to ensure the patients are alive, hospital officials said in a release. So if these suspects who are needing treatments are also facing charges, do they not have correctional officers in this facility? Is it all medical professionals? I'd like to know about that place. We know the patients find viability checks disruptive of their sleep. Let me repeat that shit again. We know that patients find viability checks disruptive of their sleep. Interim Superintendent and Chief Medical Officer Dr. Sarah Walker said in a statement, "We hope to find a technology solution that will be less intrusive." How about just fucking be honest with your patient? Listen, bitch, if we don't come and check on you, you might be dead by the time we get there. Are you okay with that? Because I'm going to put that shit in your chart that if you don't let me do my hourly roundings, your ass might wind up dead. If you're okay with that, sign that release. Now, Catch-22, can a psych patient sign a release saying they don't want to be woken up every hour? So I don't know. What technology do you need and shit? Just to have people come and check on your damn patients. She also said it is our responsibility to ensure the safety of our patients day and night. Well, where are you? How come you haven't come down there, Chief Medical Officer Dr. Sarah Walker, to talk to the staff in person? In a memo, Walker said, see, they love their emails and memos. I didn't make that shit up. In a memo to staff, Walker said the checks mean they may see more patient activity at night and encourage staff to work with patients who have difficulty with the adjustment. I don't even know what the hell that means, man. That's administrative shit right there. As challenging as responding to CMS investigations can be, it does help us identify and close gaps in our procedures and keep patients safe. Walker wrote in the email obtained by the Capitol Chronicle, "It's hard when the ground feels like it's constantly shifting underneath us. It's hard to keep up with it all, but I'm confident we can do it." What the fuck does that mean? What does that mean, Dr. Walker? The ground is always constantly shifting underneath us, and it's hard to keep up with it. The case is the latest in a string of incidents at the state hospital. In April, another patient, Sky Baskin, 27, was declared dead 69 minutes after his arrival, and federal inspectors determined staff failed to check his vital signs immediately upon arrival. Federal officials also have found blind spots in the security system and inattentive staff that failed to stop a patient on patient assault. So they're not taking care of patients who are assaulting other patients, but what are we doing why are we not having correctional officers of some sort, some big bitches that are more intimidating than probably these nurses are? Anyway, so this is a Oregon State Hospital, and this happens quite often. You know, this is a thing that happens in state hospitals. It happens in ERs all the time. So you got to make sure you do your hourly roundings. If you don't know what immediate jeopardy is, you have to pay attention to this, because immediate jeopardy is a regulatory response. The immediate jeopardy just goes in and they're going to revoke your license, or they're going to take swift action to shut your facility down or find the shit out of you. So that way you don't hurt your patients. So tell us what you think about this. I know this was a short episode, but I'm working on something real nice this week. We're going to hopefully talk to Joanne Cups. I don't know if I'm saying her name right. K-N-U-P-P, Nups, Joanne Nups. She may be on twice because she's doing a lot of good things, and she got a great story that may make you cry and may make you mad. And then we're working on some other great things. Robert and I talked about this. I know you don't know who Robert is. Maybe he'll come on fucking someday. He's always behind the scenes. We're going to start an episode every week where we are talking about a training episode where we're going to teach something and have a download ebook that you can download and get 1 CE for free. All right. So I hope you guys enjoyed today's episode. Please give us a shout out. Let us know what you think about Immediate Jeopardies, any cases that you've been a part of with Immediate Jeopardies, and let us know what you think about these kooks in Oregon. You know, I know it's not always the nurse's fault. They can only do so much, especially when you got administrators sitting behind a fucking desk and emailing and sending out memos and shit. Get your fucking asses out there and help your nurses. All right, bitches, I love you. You have a great day, man. Take it easy. Peace, bitches.
Don't miss out. Engage with us weekly, share your thoughts, and let's transform the nursing landscape together.